Okay, so today we are going to talk about COPD, that is chronic obstructive pulmonary disorder. But before I begin this lecture, I'm going to divide this lecture into two parts. First, I'm going to discuss some few points regarding the difference between emphysema and chronic bronchitis. As we know, COPD consists of emphysema and chronic bronchitis. When a patient shows up with symptoms of COPD, he or she shows mixed symptoms between emphysema and chronic bronchitis. The pure chronic bronchitis or pure emphysema is also possible in a patient, but it is quite rare. So COPD is usually consist of these two. So in this first lecture, I'm going to talk about the basic difference between emphysema and chronic bronchitis that you can see and quickly recognize. And the second lecture, which I will post after this one, will accompany the general characteristics, clinical features, diagnosis, and treatment. So let's start with the basic differentiation. In medicine, you know that if you learn one table, then you automatically can deduce what is going to happen in the another table. So just focus on either one of these table and you will come to know the difference. And again, this is just a basic difference. Just you can see the signs and symptoms and you can conclude, not the detailed one. Okay, so let's start with emphysema. The patient who has emphysema are usually called pink puffers. I will tell you why. These patient usually showed up with these patients are usually thin. They usually sit in a tripod position. That means they lean towards front for breathing. They have an increased AP diameter, that is they have a barrel chest. They are tachypneic, they have high respiratory rate. They have pursed lips. That's why they are called pink puffers. You will see their lips are pink. The patient are usually in distress because they cannot breathe properly. They usually use accessory muscles for breathing. Usually inhalation is a active process and exhalation is usually a passive process. We don't use much muscles in exhalation, but in emphysema, patient use accessory muscles. They usually use strap muscles in our neck. The usual age of these patients are 60, and if you do a chest x-ray, you will see hyperinflated lungs. Cor pulmonale with this patient is rare. It is can happen, as I said. These are usually present with mixed symptoms of chronic bronchitis and emphysema. So cor pulmonale is rare. Now chronic bronchitis. These are called blue bloaters. I will tell you why. These are these patients are overweight, cyanotic. That's why they are called blue bloaters. They are hypercapnic and hypoxemic. There is a retention of CO2 in their lungs and they couldn't get much of oxygen. That's why they are hypoxemic. Their respiratory rate is usually normal. They present with chronic cough and with sputum for 3 months in 2 years. If you see a patient with chronic cough with sputum, you will know that it's chronic bronchitis, and this sputum is usually purulent in color, telling us that there is an infection. The patient usually in no distress and there is no use of accessory muscle. But there is signs of cor pulmonale in chronic bronchitis are evident. Either it can be cor pulmonale or any long going disease. They usually also present with exertional dyspnea. So if you see a patient with chronic cough with sputum for 3 years in for 3 months, for 3 months in 2 years with exertional dyspnea, you can say that the patient is having chronic bronchitis. The usual age of this patient is age 50. So this is the basic differentiation between emphysema and chronic bronchitis. I'm gonna post another video which will tell the overall pathway of COPD.